Hello all, myself Helena Joy, lecturer from SNS College of Allied Health Science, Department of Radiography and Imaging Technology. I am going to discuss a topic about myelogram. Myelogram is a radiographic study combining the use of contrast medium with a fluoroscopy to evaluate abnormalities of the spinal cord and its nerve root branches. The procedure is usually completed within 30 to 60 minutes. Indication: suspected mass lesion, disc lesion, congenital lesion, spinal canal stenosis, degenerative diseases, injury or fractures, localized lesion at any level of spinal cord, urinary bladder and bowel disturbances, back pain radiating to the limbs. Contraindication: raised intracranial tension, iodine sensitivity, recent lumbar puncture up to 7 days, local sepsis, clotting disorders or patient on anticoagulants, traumatic lumbar puncture, pregnancy. Preparation: 4 hours fasting prior to the procedure, informed consent from the patient, plenty of oral fluids on the previous day, preparation of site of lumbar puncture, xylocaine sensitivity test, removal of metal objects or clothing that might interfere with the X-ray image. Contrast medium: non-ionic, water-soluble, iodinated contrast media. Example: Ioxol, company name is Omnipac. Iopamidol, company name is Iopamiro. Doses for adults: lumbar, Omnipac 120 mg, 10 to 15 ml. If Iopamiro 200 mg, 10 to 15 ml. Thoracic, Omnipac 240 mg, 10 ml. Iopamiro 300 mg, 10 ml. Cervical, Omnipac 300 mg, 10 ml. Iopamiro 300 mg, 10 ml. For children at all levels, less than 2 years, Omnipac 180 mg, 2 to 6 ml. Between 2 to 6 years, Omnipac 180 mg, 4 to 8 ml. More than 6 years, Omnipac 180 mg, 6 to 12 ml. Puncture position: body position for lumbar puncture, prone position, left lateral position with spine flexed to widen the interspinous space. Body position for cervical puncture, erect position, prone position with head flexed to open the spinous space, interspinous space. Procedure: the radiologist and technologist will be in the room with you the whole time. They will ask you to lie on your stomach or side on a tilting table before beginning the procedure, which consists of cleaning your lower back with an antiseptic and giving you a local anesthetic. Once the area becomes numb, the radiologist will introduce a needle into your spinal canal and then injects a contrast material into the fluid-filled sac containing your spinal cord and nerve roots. This injection can sometimes create a sense of pressure, but this is generally resolved relatively quickly as you move around from the procedure. The needle will be removed once the radiologist has injected enough contrast material. Tilting the table slightly to ensure that the contrast material flows to the particular area of interest in your spine. Taking limited preliminary X-rays of your spine once the contrast is placed, followed by a more complete CT scan of the region in your spine that your doctor believes is responsible for causing your symptoms. This is how the images of a contrast medium looks like. Imaging technique: after injection, the table is tilted slowly to allow the contrast media to reach different levels in the spinal canal. Under fluoroscopy, spot films are taken by the radiologist in different positions. The table tilt is adjusted to concentrate the contrast media in the interested area. Conventional X-ray images is taken by the radiologist as requested. After study, the patient is put in supine position. Aftercare: patient should be on bed with his head elevated 10 to 15 degrees for 8 hours to minimize the concentration of contrast into the cranial activity. Subsequently, the patient should rest for 24 hours except for going to the toilet. Observe for any delayed contrast reaction or meningeal irritation. Provide plenty of oral fluids to reduce the incidence of headache. No diet restriction is needed after the procedure. Complication due to procedure: CSF leak from the site of puncture leading to spinal headache, hypotension, subdural, extradural or intramedullary injection of contrast, meningitis due to poor aseptic solution. Due to contrast media: headache, nausea, vomiting and dizziness, transient increase in lumbar or sciatic pain in patient with sciatica due to irritation of nerve roots, confusion, hallucination, disturbance in hearing and vision. Due to anesthesia, if infiltrated too deeply, it may result in spinal or epidural anesthesia. Thank you.